Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, pathophysiology of the nephrotic syndrome. That is, why is there a nephrotic? What are the main issues in the pathophysiology of nephrotic syndrome? See, proteinuria. Why does the patient with nephrotic syndrome develops proteinuria? The patient in the nephrotic syndrome develops proteinuria because the basement membrane will lose the negative charge. Because basement membrane loses negative charge, the patient develops proteinuria. The second, here there is okay. First, there will be decreased albumin is seen in the nephrotic syndrome because albumin is lost in the urine, resulting in decreased albumin in the blood. This will result in edema. Because of decreased oncotic pressure, here the patient develops edema. Second, there is decreased transferrin is seen. This decreased transferrin will result in because of decreased transferrin is the will bind to the iron. Okay, so because of decreased transferrin, there is iron deficiency anemia is present. Actually, this transferrin is the transporter of iron. When transporter of iron is not there, even if there is iron deficiency anemia, even if you supplement iron, the iron cannot be transported from one place to another place. So obviously the patient develops iron resistant iron deficiency anemia. Then the patient will have decreased cholecalciferol binding protein. This cholecalciferol binding protein will bind to the vitamin D. Okay, this cholecalciferol binding protein deficiency will result in, because there is low vitamin D binding, obviously vitamin D helps in calcium level, so there is low serum calcium is also seen in the patients. Then there is decreased thyroxine binding globulin. If there is decreased thyroxine binding globulin, this decreased thyroxine binding globulin will cause decreased total thyroxine is decreased. Then there is decreased antithrombin is seen. In decreased antithrombin 3 is seen. This decreased antithrombin 3 will mainly increases the thrombin formation. So all these are seen in the pathophysiology of nephrotic syndrome. This nephrotic syndrome is also associated with increased fibrinogen levels are seen in the nephrotic syndrome.
thank you and thank you for watching.